Live? All right, so we're gonna get started. Everybody, thank you all so much for coming. This is the last and final session of the third day of the International Youth Conference, 10th edition. So we're super excited to be here. And before we get started, just how are we all doing tonight? Nice, I like the energy. So this is a workshop, and we're gonna try to keep things very, very interactive so that we close the day off with a bang. All right, and the title of this workshop is Youth-Led Initiatives to Address Health Disparities. So we have two speakers today, myself and my friend Kendall. My name is Derek Chen. For those of you who don't know me, I am the co-founder and chief executive officer of the international youth-led nonprofit organization, Status Health International. Our mission is to mobilize youth and engage them to advocate for global health reform worldwide. I also happen to be a New York State licensed emergency medical technician, and I am on the International Youth Conference's organizing team. Fun fact, this is the start of my second year. So I'm super excited to be here. And Kendall?
Yeah. So hey everyone, my name is Kendall Wu, and I am the co-founder and executive director of the We Vitalize Initiative, which is one of around 150 members of the adolescents and youth constituency in the World Health Organization. And so in that constituency, I am also a focal point and NGO representative. So yeah.
Yeah, and huge thanks to everybody else on the organizing team, Kelly, Ali, for giving us the opportunity to speak to all of you tonight. We're super excited to teach you all about global health and show you how all of you can create meaningful change. So our two objectives tonight is one, provide you all a concrete understanding of global health disparities, and two, demonstrate to all of you how you can create positive change through healthcare solutions. So how many of you here have heard of the term health disparities before? Okay, so just a couple of people, but that's great because no matter if you're an expert on health disparities or if you're someone who has just a surface level understanding, our goal tonight is to help you take away something meaningful that you can hopefully implement into your own communities. And to start, we wanted to define two key terms. First and foremost is health disparities. So the World Health Organization defines health disparities as systematic differences in the health status of different population groups. So essentially, in simpler terms, this means when different groups of people are disproportionately affected by different injuries, illnesses, and diseases because of factors such as socioeconomic status, demographic, geographical location, religion, anything that's really out of their control. And as we all know, quality health, it's a human right. The term health equity means to create a world where everyone has a fair and just opportunity to attain their highest level of health, no matter any of their predispositions. So obviously, this is a United Nations related conference. Our goal is to tie it to two sustainable development goals. First and foremost, goal number 3, good health and well-being, which basically means ensuring quality health and life in people's lives and promoting well-being for people of all ages. And second of all, reducing inequalities, right? Health isn't just a science-related field, it's also a social science-related field. And so social justice is very important in the context of health disparities, especially in the case of reducing inequality amongst countries.
So I'll go into a little bit more depth about what we actually are talking about when we talk about global health disparities. So as Derek was talking about, we traditionally might think of medicine and health as a traditionally science-based field, in that it's more of the biological study of disease, illness, and how we treat this. But in the modern day, there is also what we call the social determinants of health, which do not hinge on any more STEM-heavy biological factors, yet do lead to different health outcomes and different incidences of illnesses among different populations. So these are 5 of the social determinants of health, and I'll go over a little bit of each one. So with education, access, and quality, what we mean is we're talking about medical literacy. What do people know about good health and how to obtain it? With healthcare access and quality, we're talking about hospitals, quality of those hospitals, and just medical infrastructure in general. And then with the neighborhood and built environment, think things like areas in war-stricken areas. And then with the social and community context, we might think of it more accurately in terms of mental health and how you interact with other people. And then with economic stability, we're talking about socioeconomic status, your access, your ability to purchase different medicines, and your neighborhood's ability to get access to these medicines.
Yep, and before we dive into the bulk of our content, Kendall is going to show a couple case studies of how these social determinants of health is affecting all of us in the modern world.
So here, with the COVID-19 pandemic a few years back, I thought it would be proper to use a few examples from COVID-19. So here we can see COVID-19 vaccine access plotted against the income level of different countries. And so what we can see in this graph is that despite the vaccine being invented around 2021, 2020-ish, almost 3 years later, low-income countries still only have around 30% of people fully vaccinated. And so this is probably most likely related, as this graph shows at least, to income, socioeconomic status. Are these countries able to first get that vaccine? And then once they get that vaccine, are they able to distribute it with their infrastructure? And so this is talking more about basic sanitation. We can see regions in the global south have far more people without access to basic sanitation. And so without an infrastructure of basic sanitation, we would presume that these people are more predisposed to infectious diseases like cholera and whatnot. And so I guess with global health disparities, there are traditionally two ways to really think about it. And the first one is that the incidences of these illnesses that affect health are not really equally distributed. And so here we're going back again to COVID, and this time we're plotting it against communities of adults without a high school degree. So you can see an almost like exponential increase in the amount of cases per coronavirus cases as you enter communities without adults that are high school educated. But the second, perhaps more interesting concept to think about is that even once you have the same illnesses and you have people that are suffering from the same diseases, the health outcomes that result from these illnesses are not equally distributed. And so if we move here, we look once again at COVID, and this time we're looking at once these people do have coronavirus, what is their probability of hospitalization or mortality rate? And we can see that it correlates very significantly with the daily earnings percentile. So once again, connecting it back to that socioeconomic status.
Yeah, and so what we really wanted to highlight is that it's because of social factors and societal factors that are preventing people from attaining their highest level of health. It's not technology. These technologies exist, right? We know that vaccines exist, surgeries exist, healthcare systems do exist. But the problem is that people aren't able to access these healthcare systems because of social factors like socioeconomic status and geographical location. And so for our interactive activity today, before we dive into our own experiences and our suggestions, we wanted all of you to consider the most pressing health inequities in your local communities. Think about the factors that are worsening these issues and also consider actionable steps that maybe you could take to improve these situations. So those of you in person, feel free to chat with a person next to you. And the people online, please make sure to drop your answers in the chat. So we have allocated 10 minutes of this workshop to this section. So if everybody wants to just discuss amongst yourselves and think of your own ideas, that would be fantastic. And then we will give you time to share right after. Right?
Question.
Yeah. Right after the 10 minutes, we'll give you the opportunity to share your. Right. Yeah, sure. We can sit down. Oh, that's good. So if I speak, it's good. So one quotation. Yeah. Okay. So is there any way we can see like the chat and what people are saying?
Yes.
So if I just shout out to the online audience, if you guys are in the chat, feel free to discuss amongst each other. We really want to see your ideas too, show you that even though you're at home and not physically in person at the conference with us, that your ideas do matter and they are valuable. And we really want to hear from everyone. So once you come up with your ideas, the most pressing health inequities in your local communities, the factors that are worsening these issues, and actionable steps that you could take to address it, please make sure to leave your response in the chat. And we'll be taking a few out the chat too to share with our in-person audience right after the time is up. Right. And if you have any questions, also leave your question in the chat, and we'll try to get back to you right now. Wait, do you want to just like read the chat?
Where's the chat? Oh.
Want to read it?
Which one do you want to answer?
Should I get a laptop? I don't have a laptop. But
It's like 5 questions.
okay, I mean, you could read something. Let's we have a trend of like sanitation. I don't know if it's true. What? Do you want to read the chat?
I think one thing we can talk about is like how most people think like okay, poverty is the first factor, and like oh, like the health sector is really set the way it is. So like it's very hard to change. I feel like the bad mentality have. It's one that feeds into prolonging health.
You can talk about it. Do you see anything you want to? Do you see anything in the chat that you want to like?
So I see a lot of people talking about poverty and income level disparities, i.e., one person was talking about some of the hospitals for poor people and some of the hospitals for rich people being different. And I think one thing that I did want to touch up upon is I think it's important to identify the issue, but also to identify some actionable steps or realistic steps, practical steps that we can take to sort of address these. Because I think one thing that I have seen in my few years of doing impact-based work is that we kind of take the healthcare system to be as sort of inevitable, that it's already there, it's put in place, and it's going to be almost impossible to change. And I think though it is increasingly hard to change, we do need to take action now because if we leave the status quo as is, then health disparities will always be there.
Right. Yeah.
So basically, once you guys do identify issues present in your communities, I also want you guys to identify some potentially actionable steps that might be taken to approach these. And it could be as small as identifying a local organization working on like grassroots advocacy for policies, or like just emailing local legislators.
Right, and make sure that these ideas are actionable, right? So not something super impossible, but something that maybe if you put time and effort into, you can make happen tomorrow. You give them like 5 minutes.
I mean, we don't have much more to talk about, right? What was that, like 20 minutes?
Yeah, we're 13 minutes in right now. Questions are going to take a while. And also having everyone share the...
Have to take long. What do you think about privatization, like publicization of medical insurance or healthcare insurance? It's something I've been thinking about. Should we just leave social welfare to governments? I don't have an answer to it, though. Presumably, I would prefer to yes.
All right, everyone, 5 more minutes.
So we'll give it 10 minutes to 10 minutes to talk about everything.
Yeah.
And that's so that's like so that'll be 33 minutes. Any of our I like how I said like we should take like actual steps, actually different problems.
Been live recording. We'll give it like 1 more minute, I think, and then we'll just
Where's the number of viewers? Where's the number of viewers?
top up next to live.
Oh. It's not bad, like later.
I said 5 minutes at 5:14.
It's 5:22.
So, about like 2 more minutes. Yeah, so that makes us 20 minutes. You could, I mean, you could try to cut it a little bit short so we can hear from as many people as we can.
I mean, we can give you like 3 minutes.
2 minutes is fine. 1 to 2
3 minutes.
Yeah. So, is anybody saying anything? I think we just stand up and call That's what the church All right, everybody, we're gonna reconvene now, and we're really hoping to hear from all of you. So, guys, everyone, can I have your attention, please? Thank you. All right, so we want to hear from all of you now about what you came up with, what health issues are the most pressing in your local communities, and what factors are worsening them, and then what actionable steps you came up that could be implemented to make these issues better. So do we have any volunteers in person? All right, we'll start with you. You really wanted to go. So just come up front, make sure you speak.
Can I come here?
Yeah, you can come in, just like stand here. And close to the microphone so that the online audience can hear.
Yeah. No, I'm a loudspeaker.
Okay, that's good, that's good.
So my idea is like the most pressing health issue and inequality in my community and globally is the mental health inequality. Why? Because if you're not equal if you don't have the same mental health, you can't partner, you can't communicate, you can't make a change, you can't bring a change. And then what factors are worsening the issue? Many factors. Stresses, big cities like New York, then what else? Surroundings, what else? Climate, environment, human factors, economies, industry, everything is making a noise on our heads. But what is the actionable step? This is like we have to keep calm within ourselves, within inside. try to get inside, to meditate, to work on our mental health every day, every single moment, to sleep on time, to eat healthy, to take care of ourselves, like to be the change maker, to be the one who brings welfare benefits to the other members of community, to share kindness, love, devotion, respect, and this will create a kind of coming back effect. It's kind of a life cycle effect. If you give all these values, you receive it back, and then positivity comes, and it doubles, triples, and then if there is positive, then there is mindfulness, and there is mindfulness, there is healthiness, and then let's act healthy.
Thank you. What is your name and
Armenia.
Okay, and where are you from?
Armenia.
Nice to meet you.
Nice
Thank you
to
for
meet
sharing.
Yeah.
Next. Thank you. So just tell the audience your name, where you're from, and share your story.
My name is Kumba Jame. I'm from the Gambia.
Speak louder, please.
My name is Kumba Jame, and I'm from the Gambia. Looking at the topic to identify the most pressing health inequality in the Gambia, I would say in the Gambia, healthcare is not inaccessible, but the service that is provided by the healthcare is what is inaccessible depending on where you or how you are related to the government or how you are related to those health personnel. So in the Gambia, looking at the economic disparity, you understand that people that come from wealthy homes, people that are connected to a particular sitting government have privileges in the healthcare services, and this is something that is very frowned upon by people like myself that think that healthcare should be available and accessible to everyone, despite your age, your affiliation to the government, your economic status, and also your religious or whatever status that you hold. And one of the things that I think is kind of worsening this situation is greed and also dishonesty on the side of everyone that takes that particular privilege. So I'm giving an example here. Like myself, when I work in a health facility, just because I know somebody, I am like, okay, Kumba, you can bypass the queue. I'm like, no, I'm not going to bypass this queue. I have to follow the queue because they were here before me. They are supposed to be served before I am served. Because you don't have to serve me because I am of a particular status or because I'm from a particular race or because I am a relative of yours. And one thing I think we should put in our minds as young people is that we need to put aside our differences in culture, tradition, religion, and affiliation to the government and be the agents of that change that we want to see in our societies.
Thank you so much. And I think we have time for maybe 2 more people in person. So you
I can just start here.
you come up.
Very
You
brief. Yes.
can come up. Come up to the front so that the online audience can also hear you. Yeah.
Okay. Actually, I just want to buttress what my. Okay.
Take your time.
30 seconds is okay. I want to buttress what my fellow country mate says, Kumba. But in different dimension, she talk about corruption, which is very true, and the normalcy in our society that we have as Africans. All of them can relate that in their respective country. This is very serious, and I think it's a very social ill that we need to uproot if we want to advance as we want. The issue of tribalism, the issue of connection. I know connection is everywhere, even in the United States here. Of course, nobody can deny that. But we need to be on top of certain things and bring competence and bring fairness, bring transparency in our system. These are very key in changing the world dynamics. We are not going in the right direction. The whole world is declining in many fold. And I think that is the theme of this conference about climate change, about youth empowerment and other things. Why is because people seem to follow mostly on their desire than what ought to be done. All right. So taking reference from my country, one of the health identified issue that I can say in my community related to pregnancy and induced hypertension and obstetric hemorrhage. These are very key. It's a major killer in my country. Most Kumba Kanbia or Mariama Kanbia, most of our young ladies are dying during pregnancy or giving birth. The rate of pregnancy related death in my country is too high, and it's a relatively small country, just 2.5 million population. You can imagine if nothing is done to do this, it's going to happen. And these are imparity in health. Women don't have the right nutrition most of the time. They don't have the right health facilities. You can go to a nursing or nurse, and then all of a sudden they said, you have to go till the following day, or you have to go to this particular area, or they diagnose you already what you have, but they will say, we don't have medicine here. You have to go to a particular pharmacy. Most of the pharmacy, we all know the exorbitancy in their prices compared to local medicine or public one. So this is a very key area that we have to be very serious about it as future leaders in our community. We cannot keep on what is going on now. The status quo needs to change, and it needs radical transformation. Yeah. And we cannot keep working talking about it theoretically, attending conference, attending workshop, and all of a sudden once we go, we say, oh, come on, that's how our society is. That is not a good mentality. So that's my message for you guys. Thank you.
And we'll take one more person. So you in the back. All right. And what was your name, by the way, and where you're from?
Gambia.
Got it. And your name?
Alkali.
Nice to meet you.
So good evening, everyone. My name is Hamiru Hari Masakoi, and I am from Sierra Leone. So briefly, I'm going to talk about maternal health mortality in Sierra Leone. Over the years, Sierra Leone used to have one of the highest rates of maternal health mortality in Sierra Leone. And the primary reason is because there has been lack of proper medical facilities, inadequate medical personnel, and the care that the patients need, they don't get it. At the end of the day, the figures kept on rising. So I'll give you a few statistics. For example, in 2013, we had like 1,165 deaths per 100,000 live births. And then in 2019, that figure reduced to 717 per every 100,000. And in 2020, we have like 443 per 100,000. That's due to the frantic efforts of government to ensure that they increase the access for patients. They have also ensured that we increase the awareness, because also we have people in communities who didn't know the facilities that were provided by government. So we increase awareness through that, and also we ensure that the medical facilities that are available, the personnel, are trained. Even though it is still not enough, but we are making tremendous progress. We are making inroads, and if you look at the figures now, we have one of the lowest at the moment. It's reducing. So, but that is not enough. We are going to keep pressing, because at the end of the day, we want to reduce it certainly to zero. We want a safe environment for all women to give birth and for all children to grow up. Thank you very much.
Thank you. Sure. Really quickly. Really quickly.
Yeah. Just to compliment my peers on pregnant ladies dying and why they are dying. I would say if there is no medical facilities, no institutions, no doctors, no medicines, no finances, you should be educated. If there is an education at schools for ladies, how to manage their pregnancy, how to get nutrition, food, how to find this, then we won't have all these problems. Yeah? And how to be mindful and keep mentally healthy. This is the primary.
But that's not the issue then. It's different. Like you can go into a hospital if they start a surgery for you and tell you there is no light.
Yeah.
So
Okay, in ancient times, women delivered at home.
Well, I think there's many different social determinants for our health outcomes.
All right, so we're gonna move on to. Thank you all for sharing again. Yeah, if you have any comments after the workshop, feel free to speak about it outside. But now we're gonna share myself and Kendall's experiences leading our own initiatives to address global health reform. So first and foremost, my NGO, Status Health International, just to share some of our impacts before we proceed to our suggestions and explaining what worked best for us. Over the course of the last 2.5 years, we've mobilized over 2,100 young people across high schools, colleges, and medical universities around the world in more than 115 different countries. So, thank you. And on top of that, we've coordinated more than 240 health awareness campaigns and have reached more than 90 million unique social media users with our content. And that's something that we're going to be diving in for strategies that we believe helped us succeed the most. And when I say health awareness campaigns, this is exactly what you all just worked on ideating, right? Identifying the most pressing health concern in your local community, coming up with those actionable steps, and then physically implementing it. So what we've managed to accomplish goes to show that it isn't just about thinking and dreaming about what you want to accomplish, but it is possible to actually go out there into your community and create that change. Now, Kendall?
Yeah, so we've stressed a lot about taking these small actionable steps, but with my nonprofit, one thing that I did really want to emphasize is that while we do take these small actionable steps, we should not fear to dream big. And so with my nonprofit, I primarily aimed it at building infrastructure, medical infrastructure, physical infrastructure that promotes physical activity, nutrition, and provides healthcare services. And so with grassroots fundraising, I've raised around $20,000 just through a variety of sponsorships, donations, and fundraising events. And I've organized service projects across 3 different continents and partnered with 6 international organizations. And so one thing I did want to emphasize with my nonprofit is in taking these small actionable steps, we should be taking these steps towards a big goal.
Yep, and these are just a couple pictures that we've taken throughout the course of the last couple months that we've accomplished. But now this is what we really wanted to explain, right? What exactly made our initiative successful? So the first thing that I wanted to emphasize is partnerships, right? Partnerships with other NGOs, local organizations, and especially academia. So in the past, my organization has partnered with other organizations like Doctors Without Borders, Gift of Life International, Kendall's partnered with the World Health Organization, and all of my local branches have partnered with local organizations like hospitals and medical professionals. And so something else that I wanted to emphasize is that don't be afraid to reach out to older generations for help, right? A lot of my greatest successes came through working with some of the professors from my school, working with them. They have so much experience and so much wisdom just from leading and mentoring other kids like ourselves, other youth like ourselves over the course of decades that really their opinions are valuable. And you know what? I think that IYC itself is a great example of this, right? Young people working with older people to make change happen. On our organizing team, we have older generations, but we also have younger generations. And when we all come together, that's when we're able to create that positive change. And then the second point is leveraging social media for awareness. When we're trying to create global solutions to solve global challenges, we need to unite people all across the globe, right? So the best way that I found to do that is through social media. It is true that social media can be toxic at times, especially for really, really young people, but there's also a lot of good happening on social media. There's a lot of different awareness campaigns, lots of different movements that you could kind of gain awareness for just through opening your social media apps. And if you choose to engage with it on a deeper level, social media is the way to reach billions of people.
Yeah. So what we really wanted to emphasize is that if you want to turn a sort of grassroots movement or initiative into the global scale and address these global health disparities, definitely do take advantage of collaboration with other organizations and social media, because social media nowadays can globalize really fast, right? So some key takeaways in the call to action. One thing that I did want to bring up is Derek talked a lot about making sure to collaborate and partner with the older generations. And I think that as a young person without much footing in impact-based work or advocacy, it's very important that you do forge these connections. But I also think that you should be bold and not be really fearful, and should, like I said, dream big, right? And one thing that I did want to bring up is that I don't really think age is limiting. I know a few of our speakers yesterday were talking about having to overcome these obstacles as a youth changemaker. And I think initially when you do face that doubt and criticism from people, when they're not sure if you're really serious about what you're doing, there are a lot of obstacles. But once you overcome that hump, I think being a young changemaker has its advantages. I think you bring with yourself a unique sense of energy and inspiration for everyone else. And so if we do want to challenge this status quo, I think there's no better generation to do it than us, because we basically represent change.
Yeah, and oftentimes you can see older generations thinking that maybe it's not possible to create change, right? They're so used to everything just being the same, right? Like they've tried making change when they were younger, and now that they're older, they've really just given up. But when we show up, right, young people from all across the world coming together, going into those spaces that are predominantly composed of older people. So for example, healthcare, right? The mean age in healthcare is upwards of 50 years old, right? So when we go into those spaces and we come with these fresh new ideas, that's a really inspirational story. And it could perhaps change the minds of older generations and show them that maybe it is still possible to create change. So that's it for our workshop. Thank you guys all so much for listening. We do have a little bit of time to take questions. So yeah, if anybody has questions, feel free to ask, all right?
Yeah.
Thank you. So does anybody have questions for us about our initiatives? Oh, and in the chat. If anybody has questions for us, please do show or leave your questions in the chat. Can you see the questions?
So far, nothing.
I can read.
I can see this. So far, nothing. This very complimentary. They're sharing.
So I have a question.
Yep, Kelly.
Derek, do you have an example of like a recent event where you interfaced between, like, so it was an intergenerational success story maybe, or that you didn't expect to be successful, or maybe you spoke to some younger youth with also like older generations and were able to, create some hope for them? Because I know that it's easy to, like you said at the end, get really down about the possibilities. But
Yeah, for sure. So I myself, being a student in academia, I've collaborated with a lot of older generations. I think usually I'm seeking people who may already have the idea that change is possible, but I can give you an example of when I partnered with an older person and we really were able to create change. So this example is with the Gift of Life International. It's a international non-government organization that's partnered with Doctors Without Borders. Essentially what they do is, their mission is to provide life-saving heart surgeries to children born in underserved communities, families who don't have the financial resources to fund the surgeries that their children need to live. So essentially, they're partnered with Doctors Without Borders. The doctors from Doctors Without Borders go to these developing countries and perform these surgeries. So I worked with a professor from my school. Her name is Ms. Steinberg. She's super duper awesome. Really mentored me a lot of the time when it came to my nonprofit and some of my other projects. But we coordinated a year-long health awareness campaign, fundraising campaign, where we raised over $5,000 to fund a life-saving heart surgery. And you know what, to be honest, I have to say that in that example, it might have been a little bit flip-sided, right? It was my first time trying to accomplish a major fundraising effort. She was actually the one pushing me to accomplish this level of change and accomplishing my goal. In the beginning, honestly, it being my first time fundraising, I didn't know if it would go well, if we would be able to accomplish that amount of fundraising, right? $5,000 is a lot of money. So she was actually the one pushing me. So this isn't an example of maybe me changing the mind of an older person, but it's actually an older person changing the mind of me. So if Kendall has any experiences.
So I do think fundraising is a very good example of instances in where you overcome a hump or an obstacle, and then there's a complete attitude shift. So with my experiences in fundraising with Houston Methodist and Houston Parks Board, which are just some like Houston Parks Board is the largest NGO that works on parks and recreational related projects in Houston, and Houston Methodist, of course, like largest private hospital in Houston. So in seeking fundraising from them, I've had to do a bunch of presentations, just pitch decks, and I think when you come in with a sort of a cold email and you're like this, you introduce your nonprofit, your organization, and like this is what you do. We would like funding. I think they're always very like doubtful, and they're very just doubtful, right? But when you actually start giving your pitch deck, you talk about your team, you talk about your organization. Oh, like it's 501c3. Here's like the impacts we've done in the past. There's almost a visible like attitude shift, right? And I'm not sure if this is something that other generations can sort of experience, but in my experience, they've told me firsthand that seeing like high schoolers do this sort of change, fundraising, doing this sort of impact is incredibly inspiring. And so that's where that point comes from.
Are there any questions?
Question online.
Okay. Yeah. So,
what you are planning to bring new approach to expand the horizon besides social media?
okay. So the question was, what kind of initiatives are you planning to take beyond social media to expand your organization? So social media, throughout the course of my organization at least, has been the main way for us to expand, reaching more young people in underserved countries. But let's say you're not comfortable using social media. Another thing that you could do is reach out to other just local organizations in your area, or even international organizations like the United Nations, right? They have a lot of youth supporting programs where they could send out emails to young people all across the world to help you kind of gain more attraction.
I would also say, other than social media, I think trying to be parts of international constituencies gives you a lot of awareness, or not awareness, but a lot of insight. Well, a lot more presence, right? So for my example, I joined the Adolescents and Youth Constituency for the World Health Organization, and so that is like an organization composed of around 150 constituents across the world. And so we convene regularly through online meetings. And I think in that sense, that's allowed me to build a lot of like international collaborations. So I would also recommend trying to look for more like constituencies around the world of like-minded individuals.
Yeah. And we'll take one more question in person. So
quickly, you talked about partnership with people who provide life-changing services. I want to know if there is any room that probably your organization and community partners can extend a knowledge branch to people in the South communities. For example, from where I come from, we have seen people die from preventive deaths just because they cannot afford. Some people die because they cannot afford just basic things like $50 or $100, okay, for medical treatment. I just want to know if, for example, your organization, your partners, if you have a vision where you can extend such helping hand to communities in Africa, like where I come from, Sierra Leone, because probably it's once in a year, like bringing a medical expert that can perform free surgery, even if it's for 1 week, 2 weeks, that people can benefit from it. So that's what I want to know. If there's any room for that through your organization or your partners.
yeah, I mean, absolutely, there's room for that, right? Right now, we're still in the very early stages of our organization, but we are partnered with many, many different medical universities, medical colleges, my organization at least. So one of our main focuses in these medical colleges and medical universities is that, as you probably know, in a medical education, it's oftentimes just STEM focused, right? You're learning how to perform these surgeries. You're learning all the technicals, but you're not really learning about the social side and all of these inequalities that are present in the healthcare system. So that's our goal. We establish branches there, and we try to implement this social justice idea into medical students, people who are likely to be able to progress farther into careers and then create this high level of change. So bringing more accessible healthcare to impoverished areas, that's our focus, and we definitely see that as one of our goals.
Thank you.
Thank you. Yeah, so that's about the end of our workshop. We really hope that all of you can take away something meaningful, whether it just be reaching out to maybe local people to speak about creating change, or I don't know, sharing this panel, this workshop with your family, your friends, people who you know might benefit from it. And if you're someone who didn't know a lot about health disparities for this, I really hope that you feel educated now, you know all about it. And so thank you all for being here.
philanthropic NGOs, help NGOs like the Leadership and others. You know, there are some NGOs who go to Africa to share goods. I remember one thing called Leadership. Yeah. You partner with some of these people.
We haven't partnered with them yet.